Good day, this is Edwin. Today I'll be telling you how to prepare for your oral examination. You've passed your CAPS examination, you've started your internship program, is kicking well, you've completed 75% of your internship hours. Now is the time for you to sit for two examinations. The first one is intern written examination, then you also have to sit for oral examination. These two are very essential towards becoming a registered general pharmacist here in Australia. The Australian oral examination is conducted by APRA, the health body in charge of regulating the affairs of healthcare professionals in Australia. They're going to conduct this examination. Sometimes, most time, is physical examination. You have to be there in person. But since the advent of COVID-19, and for persons living in regional area, this examination could be organized online, so you can be at the comfort of your room and sit for the examination. In my own time, I sat for the exam in my room. I have to connect through online platform to my examiners and had the examination. So how do you prepare for this examination? I know when you start your internship, you hear a whole lot of things, you get nervous, and but I just want you to relax. It's not really a big deal if you know the tactics. So you don't have to wait till 1 week, 1 month to the examination. Immediately you start your internship program. That is when you basically start preparation for the oral examination, because the oral examination is actually incorporation of what you've learned, what you're going to learn during the course of your internship. So it consists of three stages. The first one is primary health care. So it's just the normal day-to-day activities you see in a pharmacy, where a customer, a patient will come, asking for a particular medication because of a condition they feel a pharmacist can manage. So at this point in time, as a pharmacist, we need to take appropriate history. We need to interact effectively with the customer to know what they want and see if it is something we can actually, you know, proffer solution to in the pharmacy, or something that needs referral. So appropriate history taking is very, very essential. For instance, someone comes to the pharmacy asking for medication for headache, or asking medication for diarrhea, as the case may be. So we need to ask some questions to know the nature of the headache, how long it has started, what they've used so far, if they're allergic to anything. So at the end of the day, we as pharmacists, we've decided that this is a condition that we can actually manage in a pharmacy. Is something manageable in a pharmacy with over-the-counter medication, and they're not allergic to anything. It has been a short-term condition, something they've had, or something that started a few hours or few days ago, and you want to know what they've tried so far, if they're allergic to anything. At the end of the day, we recommend these medications to them, and if referral is needed, we refer them to see their GP if there is no improvement. So that is basically the first part of the oral examination, the primary health care. So you really want to be versatile in all the primary disease conditions that we warrant or make a customer, a patient, to come to the pharmacy asking for. So it may be an adult, it may be a child, it may be someone of age. So we really need to know all of these, and the right medication to give, the right advice to give, and at what points in time we need to refer them for continuous management by their GP, as the case may be. The second part of the examination has to do with legal and ethics. As a pharmacist, you need to know the laws. In Australia, you have classification of medication. You have the S2, the S4, the S8 medication. These are the major ones. There are other classifications as the case. So you need to know the laws, the rules and regulation in terms of this medication. What do you need to know about S2, the S3 medication, pharmacist only medication? We want to make sure we put a sticker on them. We want to ensure that we give the right pharmaceutical care to them when we hand over this medication to them. The S8 medication, the DD medications, what are the laws guiding the dispensing and handing of this medication to patient customers, as the case may be. You want to know the in and out, the laws, what you need to know, the ethics, the ethical aspect, and the legal aspect of the pharmacy practice in Australia. The rules and the regulation is essential. So it's literally, that is what you're going to see in part B. For me, that is the easiest. So you might be asked a question, okay, you're working in a community, a pharmacy, something related to law, people are discussing about sensitive matters of the patient in public. What do you do as a pharmacist? Confidentiality is essential in terms of you practicing as a pharmacist. You don't want to divulge customers' information to the public. You want them to have this trust in you. So these are some of the things you see: basic ethical and legal practices or principles that will ensure you work effectively as a pharmacist here in Australia. The last part of the examination, the part C, has to do with communication. To me, that is a bit complex, because you'll be given a script. It's going to be a patient pharmacist situation. You might be given a script, and you have to go through the normal processes, history taking. You want to know what the customer is using the medication for, what they've tried using in the past, if they've stopped any medication, if they're seeing different doctors, if they're going to different pharmacies to fill their medication. You want to know if they're allergic to anything, the present disease condition. So all of this will decide if the particular medication or that is contained in the script, if you can professionally dispense and hand over this medication to the patient. So I wouldn't say it's the hardest part of the oral exam, because if you know the basics, then you are good to go. You need your MH, you need your MIMS to plug in interactions. Remember, at the end of the day, you also have to contact the prescriber. Definitely there will be a problem in the prescription. Not definitely, to some extent, there will be a problem in the prescription that will warrant you to, contact the prescriber to know what the next option is going to be. Remember, before you contact the prescriber, you need to seek the consent of the patient. See, I have found a problem in this prescription. Are you happy for me to contact your prescriber to discuss about it? Then once you get the consent from the patient to go about contacting the prescriber, you go on, contact the prescriber, discuss the problem you've heard. Some of the prescriber might ask you for potential solution. What do you think we should do? So when you offer this, then you have to come back to the patient, the customer, as the case may be. See, I had a chat with your prescriber. He has asked me to increase this medication to this, or to decrease the dose, or we're not going with this particular medication. There's a change of regimen. So we relay this to the customer, and proper follow-up. And that is what Part C is all about. So you just need to be strategic. The first thing to do is to have a comprehensive history taking of the patient, and then you compare that with the medication you have on the script. You also want to know if there are disease condition. Comprehensive history taking will let you know the disease condition the patient is having at a particular point in time. You want to know if that particular medication is contraindicated. You want to know if they're allergic to anything that will make that medication contraindicated for them. So a whole lot of things, but you have to integrate, and then at the end of the day, being able to say that I can hand over this medication to this patient, and hopefully the medication will be able to do the job. And that is what Part C is all about. Part A, primary healthcare. Part B is ethics and legal and ethics. Then Part C is about problem solving and communication, with the patient, with the prescriber, and everyone that is involved in taking care of the patient. That is this part of you. But this, remember, you can't do this in isolation. The advice I got then is to form a group. When you come to Australia, definitely there will be a WhatsApp group for interns who want to write or seek for intern oral or written examination at a particular month in the year. So try to form try to join the WhatsApp group. Also try to form your own small discussion group, and that way someone can act as a pharmacist, the other person as a patient, get recalls, pass questions as much as you could, and then practice it as if you are in the real exam situation. Time yourself, or party the duration, time yourself, let the other pharmacist be a patient, you the pharmacist. At the end of the day, the more practice you have, the more confident you become, and the more chances of you passing the examination. And that is it. There is definitely nothing to worry you about, to be nervous about it. If you come to Australia the first time coming overseas, it's going to look a whole different. The system is going to be different. Sometimes you ask yourself question, what's this all? But the thing is, pharmacy practice, as I always say, is different. It's specific. The rules and regulations are different from one country to another. So when you come here, the first 1 month is going to be, oh, I don't know anything. This is different from my country. But just pay attention, get used to the scheduling of medication here in Australia. You want to know about the rules and regulation, the principles, the ethical aspect of the pharmacy practice here in Australia. Join intern group. Start preparing for your intern written examination and oral examination. Form a small group with your co-interns and start practicing as much as you could. You need your MH, you need your laptop, you need a palm top, you need MMs. So all this will help you to successfully pass your oral examination. And when you pass that, you've passed your written examination, you've completed your ITP program, and the number of supervised hours approved to you by APRA, then you are ready to apply for general registration. So to be a pharmacist here, it's not that easy, but the thing is, so many people have done it. I have done it. If you have any question about the examination, if you're confused about any step in the process, just drop your question in the comment section. Also, if you go to my bio page, you see my social media handles. I have email address. I'm also on Instagram. You can drop your question, and at my convenient time, I'm going to reply you. I'm going to provide answers to your questions, the ones that I know. Even if I don't know, I could ask someone that will probably find a solution to the question you have. Guys, that is it for today. I'm going to see you some other time. Until then, do have a nice day. Thanks, Edwin. Bye bye.